Welcome to Real Life Counseling, a podcast by The Counseling Corner. I'm Ryan, and I'm here with Dr. Ernie Reilly, along with Amanda Riendeau and Andreina Bello from the Counseling Corner team. Today, we're talking about something that can feel really heavy for parents: trauma in children. A lot of parents hear the word trauma and immediately think of one major catastrophic event. But in real life, trauma can show up in many different ways. And in children, it often shows up through behavior long before it shows up in words. Trauma is what happens when a child experiences something overwhelming, frightening, or deeply upsetting, and their mind and body don't yet have the tools to process it. It's when the demands of the situation and the child's ability to cope just don't match up. In simple terms, trauma is when something feels too big, too scary, too fast for a child to handle, and it leaves a lasting impact on how they feel, think, or behave. It's not just about what happened, it's about how the experience affects that child. So today, we're talking about how trauma therapy helps children heal, what trauma can actually look like in kids, and what therapy looks like in real life if a parent decides to take that next step for and with their child. Our goal is not to scare parents today, it's to give them clarity, hope, and a better understanding of what healing can look like. So let's jump in. Our first segment we titled Trauma or Just Acting Out. I want to start really practical. I want to go through some behaviors that parents might describe as acting out or being dramatic or maybe going through a phase. And I want you to, as the experts, maybe help us understand what could be going on underneath that situation. So, Amanda, the first prompt is for you. A child suddenly becomes more angry and defiant.
So if a child is suddenly becoming angry and defiant, right? Going back to some of our previous episodes where we're talking about like frequency and duration, right? What's happening that's different, then that's something that we're probably wanting to keep an eye on. Parents might be saying, oh, this kid's in just one of those moods, or oh, this must be one of those phases those other parents were telling me about. But we don't want to assume that that is the only thing that's happening. Maybe there's a stressor at school, big exam, they failed a math test you don't know about yet. Other kids are picking on them at school. There could be so many things that are going on that our kids are not sharing with us as parents.
Okay, prompt 2 is for you, Andrina. A child gets clingy, fearful, or suddenly can't sleep alone.
That often points to anxiety or a need for safety. So if the child is trying to stay close to you, it's because they want to feel secure.
Yeah,
I
usually
also have to agree.
yeah. Usually that means something's going on, right? That doesn't usually come out of nowhere.
Got it. All right, prompt 3 then for you is Dr. Ernie. A child starts regressing, having accidents again, going into baby talk or shutting down.
Yeah, when a child starts regressing, accidents, baby talk, shutting down, that's not them going backwards. That's them asking for safety. Regression is one of the clearest signs that a child's system is just overwhelmed, right? They don't have the words or tools to say, this feels too much, and they don't have the power to fix what's causing their suffering. So instead, their behavior is usually what speaks for them. It's the brain and the body saying, I need help. I need to feel safe again. So usually it's something going on with the child that's causing that.
Got it. It's so funny. I feel like over the last, the child episodes that we've done, the child focused episodes, there's this language that kids have, but it's all through body. So somebody ought to write a book on like a translation guide, how to understand your kid based on what they're doing, not what they're saying. I would read that. Probably
That's what play therapy really is all about,
Okay.
right? We're paying attention to the child's body, their facial expressions, their play, the themes in their play, because play really is the language of a child, right? And their body really is expressing so much more. I mean, our bodies are expressing it too. We just have a lot of verbal skills on top of that. They have very limited verbal skills, so it's all being expressed through play and their bodies and their emotions.
That's a very good note and a helpful way to understand play therapy and why it even exists. Okay, prompt 4, Amanda. A child seems fine one moment and then melts down over something small.
So sometimes when kids are overstimulated. And so we're using that particular word again, right? This could be environmental. This could be some kind of trigger happening at school. Right? Their bodies are their own little thermometers, right? And if something feels extreme, we might see extreme behavior. We might see acting out. We might see throwing themselves on the floor and kicking and screaming over the fact that you asked them to go brush their teeth. Um, so while some of that might just be something minor from a parent's perspective or from an adult perspective happening in their environment, we still want to be very watchful and make sure that there isn't something that is leaving them to feel unsafe. Um, so, certainly something to keep an eye on, not something that I would say we need to freak out, but we probably need to do something about it.
Got it. Okay.
And sorry to add on to what Amanda is saying about the meltdowns over something small. Normally, we can point to the situation that happened something small, but in reality, it can be build up stress coming out. It looks sudden, but it's probably like been building over time.
Got it. Okay. So we are having a conversation on trauma in childhood. And before we go further, I do want to clear up what trauma is, because I've heard it more and more and more, right, over the last several years. And I want to clear up what that is for kids, especially within our sphere. So, Dr. Ernie, how do you explain trauma in a child friendly and parent friendly way?
Sure. For a child, trauma is when something feels too big, too scary, or too fast for a child's brain or body to handle it at the time. Right? It's just not about what happened. It's about how the child experienced it. I might explain trauma to a child like this. Sometimes something happens that feels really scary or confusing, and your brain doesn't know what to do with it yet. So your body just keeps remembering it, even when it's over. So might be how I'd explain it to a child. For parents, for a parent, a few key points that really help. Two kids can go through the same event, and one may be okay while the other one struggles. Right? That's really common. Trauma isn't only big events. It can also be repeated stress, fear, ongoing feelings, being unsafe, things like that. It really is when your coping skills, your ability to cope, and what's required in the circumstance don't match. That difference is traumatic. It means that this was over and above my ability to cope. That's why you might see things like regression, baby talk, accidents, big emotions, really big emotions, acting out, shut down or withdraw, clinginess or fear. Because kids don't say, I'm overwhelmed or I can't handle this. They show you, they show it in their behavior.
Got it. Okay. So, Andrina, what are some experiences that might affect a child more deeply, maybe in a more traumatic way than adults might realize?
Well, I would say like divorce or separation is a big one. Um, you know, conflict between and the parents, like high conflict, divorce, bullying, the loss of a loved one or a pet,
Mm,
medical. Yeah, the pet can be like, sometimes it can be like the first loss at times, um, medical like a big traumatic experience, or even maybe like a broken ankle can be traumatic for a child. Accidents, instability at home, abuse or neglect, or maybe changes in the environment, caregivers or environment.
mm,
Yeah, Ryan, one of the things that we found in research is that in a high conflict divorce situation, the child oftentimes will be impacted the same level as if one of the parents passed away. And it can
mm.
really be quite significant. So these things can be things you might not expect, but when you lower the temperature during a divorce, you really are helping your child, their ability to cope a whole lot. And there's so many things that could go wrong. There's the normal ones that you'd expect, and then there's ones that you might not even think about that could impact a child.
And sorry, and another one that's traumatic that came to mind is when somebody in the family, like parent, has alcoholism or substance abuse, that can also be really traumatic for the child.
Yeah.
And then to
Yeah.
also throw in some of the like really super obvious ones, right? Again, we go back to like active shooter drills at school. Being in an active sort of situation like that. Natural disasters, because where we are, that seems to be happening more and more frequently, that we're having really intense hurricanes that are wiping out small cities and tornadoes that didn't used to occur so close together in certain spaces. Things like that too can impact kids.
So, uh, prompt then for you, Amanda, especially a lot of those things are shared experiences, right, across the community. It's a whole community of people experiencing the natural disaster, or a whole school of kids experiencing the drill. Why do two kids sometimes respond differently to these same events? But this is the same event, two kids have different responses. What's going
Well,
on there?
one, if these are two kids in the same household with the same family members, right? We kind of look at it maybe in the way of how I sometimes with my clients will describe perception. Okay. But we're going to use this in the way of like resiliency and coping and how they're using those skills and maybe what their developmental levels might be. Because again, you have two kids in the home, they could be 8 and 9 years old, so only several months apart. They're very different children. So we come at it thinking about perception. If you and I, Ryan, are looking at the same Kleenex box, and the Kleenex boxes are all really cute now. They got designs and they say cute phrases on them. You're sitting on one side of the Kleenex box, and I'm sitting on the other side of the Kleenex box. Our images that we're seeing might not be the same, kind of the same thing. Just because they're in the same space doesn't mean they were impacted in the same way. And
That makes
certainly we would go back to if there are two kids at one school that are not related, their whole life experience will change and alter how they process and go through something.
Ryan, just going along with that, two kids in the same household. So you'd say the same household, same family should have the same experiences. They don't even have the same parents in the sense that their relationship with their parents is
Mhm.
different. Their developmental stage is different. Even if they're twins or triplets or something like that, they have different experiences, right? So and then if there are significant age differences, you can say, we grew up in the same household. Yeah, but you experienced when you were 3, dad was 43. And when I was 3, dad was such and such age. That's very different. Different things were going on. So
yeah.
even when you're in the same household, you really don't have the exact same family. You have your sibling is different. Their sibling is you. Your sibling is them.
Mm.
That's different, right? The parents are different. The relationships are different.
No, that's good, and I feel like we've got a really strong foundation now. I think of trauma within the childhood space, and how it's defined, how it impacts, how we look at it, right, from our vantage point. Um, so I'd love to hear, for a parent who's listening, thinking like, I think some of these things might be my child. My child might maybe have experienced some trauma that, one, I know about, or two, I didn't maybe know about before, and is curious what happens in trauma therapy. Andreina, can you tell us what a first session might look like for a child who may have experienced trauma?
Well, the first thing I would do is to, make them feel comfortable and not try to push them to talk, especially because, sometimes children that have been, traumatized, maybe there's been, unfortunately, sexual abuse and they have been already interrogated by investigators. They're tired of like giving the same story over and over.
Mm,
So the idea is for them to come to a place where they feel safe and they can actually be in control of their environment. Because when trauma happens, there's some loss of control, sense of control. So you want to give them back the power, back the control.
Good point. Yeah, you don't treat control when control's been taken away. You don't treat it by taking away more control. You
Right.
treat it by helping them feel safe and giving them some sense of control.
that's great. So One of the things that we've talked about, though, in terms of how we define trauma for children, is that it's beyond their ability to cope. It's beyond what they can handle right now. So, Amanda, if a child can't explain what happened, or maybe doesn't want to talk about what happened, how do you still help them?
Well, I think Audrina brings up a really important piece. It's about bringing them into a space where they can feel safe. They don't have to have the worries of the excessive stressors. They aren't going to have to sit down and repeatedly tell the same story over and over and over again. We're going to be in a space where they get to be free and themselves. And so that's where we're using a lot of our skills with play and art and cooperative gameplay and just getting a chance to know each other. They feel like this person is safe to be around. They'll start to share tiny pieces when they're ready.
Got it. Okay. So I did feel like you teased some of the answer a little bit, but I'm curious, Dr. Ernie, can you maybe help us understand how trauma therapy is different for children versus maybe a trauma therapy approach for adults?
Yeah, Ryan, great question. Most people picture trauma therapy as sitting down and talking through painful memories. That's how it works a lot of the time with adults, but certainly not with kids. Adults usually process trauma through words. Kids process it through play, connection, feeling safe. So kids don't have to explain everything. They show us through how they play, what they avoid, how they respond. We're paying attention to all of that, really focusing on what they're showing us. Think of a child's brain sort of like a filing system. When something overwhelming happens, the files just kind of like get left out. Right now, they're laying on the table, and when something reminds them of them, it's like it just happened. It's right there, right? And so therapy isn't about making a child relive something in exact detail and such. It's about helping them feel safe enough that their mind and body don't have to hold on to that same thing in that same way.
Mm,
Remember, trauma doesn't mean a child is broken, right? It means their system is overwhelmed. And with the right support, they can heal and they can grow. And kids are really resilient. Kids can get through this if they have the right support.
awesome. Okay. Thank you for walking me through all of that. One of the things that I really like to do, especially around topics that are a little heavier charged, is to bust some myths um, together. So we're going to do this a little bit quickly. Um, I'm going to give you a few common beliefs that I found parents have about trauma therapy for kids, and I'd love to get your responses to them. So, Amanda, this first one is for you. If my child isn't talking about it, they're probably over it.
Loud and resounding myth.
Okay.
And kind of going back to what we were just saying, right? The kids don't often entirely know exactly what they're feeling or how to express that with words. So just because they're not coming out and saying, like, hey, this is still really bothering me, doesn't mean that it isn't.
Hmm. Okay. Well, number two, for Andrina, talking about trauma will just make it worse.
That's also a myth. When talking about trauma is done safely, it actually helps the child process the trauma instead of holding it in.
Okay.
I remember, just a quick, experience that I remember after COVID, post COVID, that was traumatizing for a lot of people, including a lot of children. And I had a child that came to my office after, people were starting to leave their houses. And the first thing that we have a little Lego city in the office, and the first thing that the child did was to place all the little Lego people inside the hospital, the houses, and we need to keep them safe. We need to keep them, and to them that might have been, their way of processing something traumatic. Doesn't have to
Mm.
be a big thing. It was just this way of processing it.
So, can you give an example? Can somebody give an example of when talking about trauma with a child is done unsafely?
Yeah, I got an idea. So one idea would be when it's done to meet your need as the parent. right? So if you're opening the door, if you're giving the opportunity for the child to speak and they're stepping through, that's very different than when you feel nervous, you feel upset, you feel this needs to be talked about, or it's triggering their parents' own trauma. And so they're interrogating or they're talking about it in a way that the child isn't comfortable with or isn't child centered. So what Andreina was talking about is very safe, therapeutic talk about it. We can't just assume because a child isn't talking about it that means that there isn't an issue, and we can't assume that talking about it is bad. Right, talking about it probably is good, but it has to be something that's very tuned into the child's. It's sort of like taking the child's pulse,
Mm,
uh, and the child's temperature to make sure it's fitting with the child.
okay, that's helpful. I appreciate the difference there. Thank you. Dr. Ernie, can you respond to this statement, which I hear a lot? Kids are resilient. They just bounce back.
Yeah, kids are definitely resilient. They do have an amazing ability to adapt, recover, and grow through hard things. But the important part is resilience doesn't mean kids bounce back from trauma on their own. It means they can bounce back with the right support. So just like a physical injury, a child's body has an amazing ability to heal and recover, much better than ours as adults, right? But without proper care, that healing not occur properly. It may take much longer, causing much more suffering and a lot more problems along the way.
Mm, okay. Amanda, if my child is laughing and playing, they can't be struggling that much, can they?
But they can, right? We think about this in terms of being an adult, even when we had the loss of a loved one or something significant has happened to us. We're typically the ones who go, well, I still got to get up and go to work. I still got to get up and make dinner for my family. Still have to make things happen. So just because your child is laughing and playing and seems to be comfortable, they're doing what they need to make it through the day. It doesn't necessarily mean they're okay and they're not struggling.
Okay. And
Yeah,
then
right.
last
One
one.
other thought with that is in the process of adapting to something, one of the things that we can, like with grief, one of the stages of grief we oftentimes will refer to as one of the things that can happen is a stage called denial. And
Hmm.
denial isn't you're denying that it happened. Denial is you're operating as if it didn't happen. And we can slide into that. And thank goodness that exists because it
Sure.
really does give a reprieve, right? A break from those difficult times. So simply because a child is sliding into that does not mean that the child isn't impacted. They may be very impacted, right? They may not be. It could be that it really didn't impact them a lot and that you want to look at it over time and such, but it may very well be a sign that they're just sliding into that grieving.
Okay. Thank you. Last one. For Andrina, therapy is really only necessary if something extreme happened.
Right. And that is, again, a myth, in my opinion. Uh, um, and you would have to look at, the definition of extreme according to the parents to, um, it goes back to perception, what the child perceives as something that can impact them and something that it might be causing a behavioral issue, or an emotional, um, you know, effect on the child. So even the smaller things that we consider small can have a great impact on the child.
All right. Thank you for helping us dispel some myths around childhood trauma. So, as we are coming to the end of our conversation, I always like to make sure that our parents have something that they can take home and maybe be working on with their kids this week. So, if a child has experienced something overwhelming or distressing, I'd love to hear from each of you. What are some things that can help healing at home? Dr. Ernie, can you give us the first one?
Sure. Children need a consistent sense of safety, emotional and physical safety. They need to know that they're safe and that someone has their back in difficult times. That means calm, steady parenting, predictable routines, a place where their feelings are allowed, even when they're big feelings, right? Healing happens when a child feels safe, right? A child can say, I'm safe now. I'm not alone in this. That's when healing begins to happen. So one of the things to do to avoid is try minimizing or rushing past trauma. Just because we're uncomfortable with it, which it is really uncomfortable to have someone you love going through trauma, especially a child. But be careful not to rush through it. Just saying things like you're fine or that wasn't that big of a deal. We may wish that was true, but that doesn't make it true. And it doesn't usually help. Even if it doesn't seem big to us, it may very well have felt very big to them. When we slow down, we breathe, we stay with them, and we take their experience seriously, that's actually what helps their brain and body start to settle and starts to heal.
That's a good word. Okay. Thank you. Amanda?
So children need support and the opportunity to feel heard and not accepted, but acknowledged. Right? I can see you're really struggling right now. Is great. That opens the door to allow them an opportunity to be like, you know what? You're right. Thank you for noticing. Let me share a little piece of that. Or really, I didn't even notice, but maybe you're right. Give them the opportunity to feel like you're there. That's all they need. It kind of goes back to what Dr. Ernie was saying with safety. If they know that you're there and you can help them through something, show them that. Acknowledge that what they're feeling is valid and okay in some spaces. As far as something to avoid, I might go back a little bit to the projection of your own trauma and worries and fears. It's kind of like, right, when you corner a dog, if you're showing that you have fear, they're going to lash back out in fear. Right? So give them the support. It's okay to say like, hey, I'm really scared too. That was an awful experience. But don't give them your feelings to experience. They have their own they have to carry.
Most definitely.
That's good too. Okay. Andreina, can you bring us home?
Yes. So children need predictability. They also need to feel understood. They need to feel understood and not managed. So as a parent, avoid managing your children's feelings, their emotions, and just, try hard to remain calm in traumatic situations and to give them that space, that support.
Great. All right, I'm going to talk to our listeners as we come to the end. When children experience trauma, they don't always have the words to tell us what's wrong, but their behavior, their bodies, their emotions, and their relationships often tell the story for them. Trauma therapy helps children heal by giving them something they may not have had enough of in the moment: safety, support, and a way to process what happened in a way their nervous system can actually handle. And the encouraging part is when kids have that right kind of support, they're incredibly capable of healing, like Dr. Ernie said. Your presence, your calm, and your willingness to show up and get help when needed matter more than getting it perfect. If you're a parent and something in this conversation made you think of your child, that doesn't mean you need to panic, please. But it may mean it's worth paying attention, and you don't have to figure it out alone either. To learn more about child trauma therapy, play therapy, and counseling support for families, visit counselingcorner.net. In this episode, if we helped you, please share it with another parent and subscribe to Real Life Counseling. Leave us a review, drop a few comments. We'd love to hear from you and get some feedback from our listeners and what you want to hear about next. Thank you, Dr. Ernie, Amanda, and Andreina, for a wonderful conversation. I hope you all have a great night.
Thank you.
Thank you.